So, for the sake of the listeners, could you explain a little bit about metabolic psychiatry and why it differs to the standard approach?
Yeah, sure. So the standard approach, or the way I was trained in allopathic medicine, which is just Western medicine really, um, was you take a history, you make a diagnosis, and a diagnosis is just a group of symptoms. And within psychiatry, often a lot of diagnoses overlap with each other, so you have symptoms in common, and it's not unusual to see several different psychiatrists, and you might receive several different opinions on your diagnosis. And people often are diagnosed with more than one mental disorder using that classification system. But usually that's to target drug treatment, so pharmaceutical treatment of mental health symptoms, whereas a metabolic approach takes into account somebody's nutrition, history, and their metabolic health. And when I talk about metabolic health, we're really talking about whether somebody might have pre-diabetes or may have lived with high levels of insulin for many years and have metabolic dysfunction, which you'll know is so common these days. Metabolic psychiatry differs because you have more natural ways of approaching treatment with somebody, so you can actually use changes to diet and dietary strategies to have quite profound improvements in mental health, including improvements in severe mental illness. So what we would refer to as chronic and enduring mental disorders such as schizophrenia, bipolar disorder, severe depression, those kind of issues.
Yeah, incredible.